Australia very low and no college. I consider just 8 pharmacy college. So they are producing very low number of pharmacists. So they need pharmacists to work in the retail pharmacy or hospital pharmacy. That's why the Australia and New Zealand the best time to migrate, especially in the next year. Uh, so academically, basically provide the assistance, A to Z assistance, basically for any healthcare professional to migrate to Australia, like medical doctor, dentist, pharmacist, physiotherapist, dentist, and physiotherapist, or veterinary doctor, optometrist, lab technicians. So we provide courses for everyone. And this is about myself. So basically, I completed my PhD from University of Sydney. So this is one of the oldest university in Australia. This is the first university established in Australia in 1849. And the pharmacy school also is the first school established in Australia. This is in 1899. Okay. So this is very, very old university for pharmacy and medical education. And this is the 17th rank in the world, worldwide in the medical school. And if we talk about in pharmacy, it is the 4th rank in the world. So academically, basically, why I started this academically. So I was a student, PhD student. Even after PhD, also very difficult to get permanent residency or citizenship in Australia at that time. Okay, so all the students was talking about to write the exam and pass the exam, this KAPS exam, and become a pharmacist. Even after the PhD. Okay, so even after PhD, if anyone want to work in academics, want to work as a professor in Australia, so you must be a registered pharmacist. Without registration, very difficult to find job, especially in the pharmacy practice, clinical pharmacy, or pharmacotherapy, pharmacology-related subject. Those are lab-related subjects like pharmacochemistry, pharmaceutics. In that case, might be they waive, give you no need registration. But if you are any subject you are involved in the patient-oriented teaching, you must be a registered pharmacist. So at that time, I thought that it took me around 8 years to be in Australia, but this journey can be shortened to 6 months. So any Indian pharmacist can write this exam in India. Basically, the exam center currently there are 3 centers in NCR. That is one is the Delhi, one in the Gurgaon, another one in the Noida. So 3 centers in North India. So you can write this exam there online, and once you pass the exam, then you can migrate to Australia with your family on permanent visa, on PR visa, or you can get an Australian citizenship. Okay, so this is the registration. Very easy and very short time will take. So basically, I start this academically. So academically currently provide 2 assistants. One is the study abroad if you want to study in any higher degree. But I do not recommend personally to go again to study like master degree or PhD. There's not much advantage in Australia. Australia, basically, if you are just bachelor degree holder and completed your degree, and you can work in as a pharmacist, the salary is very, very high. So salary in Australia are not defined by the degrees. In India, we think that if you are a higher degree holder, then you will get a higher salary, and maybe in the good company will hire you. But in Australia, bachelor degree is enough. If you are M.Pharm, it's good for you. But if you are a PhD holder, again, you have to go like research side, like opportunities are very low in that case. Okay, so we provide assistance for study in abroad, but I do not recommend to go for it because you need to invest basically 30 to 50 lakh Indian rupees if you want to do any MS or master degree in Australia. So the easier process for you to register yourself as a pharmacist in Australia, and then you can migrate. So as a pharmacist, basically you can migrate as a retail pharmacist or hospital pharmacist, you can work. So there is a 3-step process you need to complete. First is the document verification, or also called initial assessment. So this process we will complete behalf of you. You just need to provide us your documents. Sorry guys, this is my son. Just give me a sec. So guys, sorry. So basically, if you want to work in retail pharmacy or hospital pharmacy, so three-step process you need to complete. First step called initial skill assessment or document verification. So this step we will do behalf of you. You just need to
Your
provide us.
another window is actually on the PPT, sir. So it's not clearly visible. Yeah, now it is okay. You can just make it slideshow. Yes,
Now is
it is.
okay.
Yes, yes, yes.
Okay, so basically, if you want to migrate to Australia, the three-step process you need to complete. First, the document verification. So this document verification done by Australian Pharmacy Council. So this verification we will do behalf of you. You just need to provide us your document, a scan copy of your document, like you completed your bachelor degree or master degree. Degree we need, then we need your transcript, your registration as a pharmacist in state pharmacy council, then we need your passport. I mean, just normal documents required for, and it may take around 2 months, and they will say that now you are eligible to sit in the exam. So this is the KAPS exams you need to write in order to migrate Australia or New Zealand. Both countries have the same process. There is some difference. I will explain in the next slide. So CAPS exam basically is knowledge assessment of pharmaceutical sciences. So whatever you study in your bachelor degree, they want to just check your knowledge, and the passing marks required 50% only. This is a multiple choice question. Okay, so this is very really easy exam for you. And once you pass this exam is conducted yearly 3 times: March, July, and November. Every year they conduct, and there is so many centers in India. Currently, there is eight centers. As I mentioned earlier, like Delhi, Noida, Gurgaon, then Pune, Mumbai, Bangalore, Hyderabad, and Chennai. There are the eight centers. You can write the exam there. And then once you pass this exam, then you also need to pass the English test. So we will provide you the coaching for English for you, and for 4 month coaching. So 4 months is more than enough to pass this exam. 3 month coaching we provide to complete the syllabus, and 1 month revision. So these are the three steps you need to complete in order to migrate to Australia as a retail pharmacist or hospital pharmacist. So for pharmacists does not require any work experience. So if you are a fresher, you do not have any work experience, you can migrate to Australia as a pharmacist. The reason, anyone can give a reason why they are not required any work experience in Australia? Any idea? Because you are
No,
a
sir.
overseas, because you are a overseas qualified pharmacist, right? So you do not know anything about Australia, Australian law, and how to communicate with the patient. So Australia believe that once you pass this exam, then you have to work 1 year as a intern pharmacist. So intern pharmacist is a internship, but it is a paid internship. You will get the salary around 3 lakh Indian rupees or 6,000 Australian dollar around per month. And half of the money you can save basically if you migrate to Australia. So that's why the work experience is not required. So once you pass the exam, then you have to do 1 year internship, paid internship. Then you can become a registered pharmacist in Australia, and then independently you can practice. But someone already completed master degree or bachelor degree from India, and now they are working in pharmaceutical industry, especially in the manufacturing side or QA, QC or F&D or R&D. And in